Good morning, good afternoon, good evening. Dr. Makiwane, your host here. I'm back today with a topic that is very sensitive. I would like everyone to invite friends, more so in-laws. I would like to see a lot of in-laws here, colleagues, friends, husbands, wives. This is a topic that I feel in Africa is under discussed or underutilized in terms of knowing what's going on about it. So I would like us to invite all of us, and more than anything, bring your compassion, your kindness when you come join us here. I am joined today by my lovely friend in Ghana, Mr. Samuel Afo-Kangah. He is a senior mental health officer in Ghana Mental Health Services. He is going to tell us more about what entails um, mental health in the space of infertility. And shortly here, we'll be joined by my colleague. He's trying to connect. I don't know what happened there. Without wasting our time, I'm going to introduce our topic today. We're talking infertility and mental health connection. There's actually a lot of issues going on there. And I would like I said in the beginning, please invite your in-laws. I would like to see father-in-laws, mother-in-laws here, sister-in-laws, brother-in-laws, because you know what, in Africa, that space of in-laws is something that contributes a lot in terms of mental health issues and trauma. I'll be honest with you guys. So yeah, before we start, I want to introduce this topic to you. Infertility affects men and women equally. I would like you to pay attention to that part. It affects men and women equally, 50%. And I know that because of patriarchy in Africa, men tend to think when a woman is not conceiving, the fault is hers. No, that's why I said in the beginning, let's invite our in-laws to join us in this conversation. And I would like you to understand that actually, thank you so much, Dr. Mzi, he joined us. It
Thank
affects,
you.
thank you. It affects 50 to 80 million people worldwide. That's infertility. And in Africa, it affects the southern part of the Sahara. Without wasting our time, I'm going to introduce our new guest here, Dr. Mzi. Dr. Mzi Tshatshela is a family physician specialist, and he works here in Canada with me. He's going to actually take us through the process of infertility, what we need to know. And like I said, please invite your friends, all races, all cultures, because we have these interracial uh, marriages in Africa, relationships. So I would like you guys to bring all your friends, your relatives, your in-laws. Of course, I said my special guests, I would like it to be in-laws because they tend to cause a lot of mental health issues towards a woman who is not conceiving. All right. I'm going to let Dr. Mzi take us through this topic. Dr. Mzi, we see infertility in our clinics. We see it. We've seen it in Africa. We both come from South Africa. We've seen it. What is your experience in terms of seeing what happens with infertility between couples? Or just take us through. People probably don't even know what infertility is. I'll let you take us through, Dr. Mzi.
All right. Hi, everyone. Hi, Sam. Thank
Hi,
you.
doctor.
Infertility is it's pretty common. It's one of the most distressing things that we get to see. And unfortunately, I always say the biggest enemy will be stigma. It is quite stigmatized. And you'll find that depending where you are, then the stigma is different and shaped in many ways. And really, one of the things, as you were saying, it's always good to include the in-laws and everyone who will be part of this couple. So in general, it's about 10 to 15% of couples will face infertility sometime in their life, and about 30% is a male issue, and 30% it's a female issue, and then the other 30% we can't really explain, that we can never find an issue. So, which in that case, you try and try, you can't help the female, you can't help the male. and it can be quite distressing. But it's highly treatable. And one of the things that's becoming a big problem now is it's become quite an issue um, in terms of finances. It's quite costly, and I've seen people going for one treatment and then they leave it there because the funds are depleted. And so it's quite a challenge. And I will go then through the causes um, in general. So, just in general. So, we're saying infertility is when you fail to conceive after trying to fall pregnant. That means when you've been having unprotected sex, regular sex, for a year. So then we would discuss that, we would define that as infertility. Um, um, and then it differs from age to age. If you are under 35, then we give you a year. If you are over 35 but younger than 40, we give you 6 months. Then we would say you are infertile if you've been trying for 6 months. And then, of course, if you are over 40 and been trying for however long, we get consent, and it's quite an emergency. So, so we'll go to the male causes of infertility. So in males, we have issues with sperm production. If there is no production of sperm, so completely no sperm, azoospermia, or abnormal sperms. So when they get analyzed, you find out that the, the shape is not normal, or they are not moving as they should. And sometimes there's a problem with the delivery of the sperm. So in couples that are facing erectile dysfunction, in genetic issues like cystic fibrosis and structural problems. Let's say people have strictures in the urethra, or people who've had issues with their testicles as well. So when there's in that pathway, when there's an obstruction there, then we get issues. And then, of course, some are environmental, some can be caused by certain medications or cancer treatments. We've known people, if they get testicular cancer, some would preserve their sperms so that they can use them later. But some people who don't get that chance, then they end up struggling with infertility. And then yeah.
Before you go, I actually picked up something you mentioned, the stricture. The stricture, which is usually the blockage in the urethra, the pipe that men have to pee. I would like you to touch on that, because right now in Africa, what we see a lot of times, women are unable to conceive because of fallopian tube dysfunction, because of infections. And I would like you to touch on that, because truly men, they tend not to associate it with them too, because of the sexually transmitted infections we are struggling with in Africa. Thank you for mentioning that stricture. I really paid attention to that when I saw that.
Yeah, so certainly that comes under the female causes. So strictures in male and then in females. So we'll start with we would say in females fallopian tube damage, as you said, and the biggest cause of that would be untreated STIs, or pelvic inflammatory disease, causing the adhesions and causing permanent blockages there. But there is hope. Sometimes the adhesions can be treated. Sometimes they are so severe that nothing can be done. And again, it comes down, unfortunately, to an issue of inequality, where if people don't have money, then they don't go forward with the treatments. And that's one of the things that, as advocates in healthcare, we are trying to change, so that we make this accessible to all females. It doesn't matter what socioeconomic class you are from. You should get the treatment that will help you. So, and other issues are ovulation issues, and those are pretty common as well. So in people who have things like polycystic ovarian syndrome, you find that they have menstruation, but they're not releasing the eggs. Excuse me. Um, and then issues with the uterine or uterus or the cervix. So if they're structural, some of the things are the ladies are born with abnormalities, and some of them would not know until they get investigated for infertility and find out that, oh, actually there's a problem with the structure of the uterus or structure of the cervix. And endometriosis, which endometriosis is pretty difficult to conceptualize for most people, but it means the lining of the uterus has migrated to other parts of the pelvis and causing issues there. So it's usually ladies who would have chronic pelvic pain, painful periods. Not all painful periods are caused by endometriosis, but that's usually one of the cases. And then some of the people have what we call ovarian failure or primary ovarian insufficiency. So they would talk about early menopause. You hear that they've lost their menses before the age of 40, some even earlier. It can differ in severity, and sometimes adhesions. So there are adhesions from infection, pelvic adhesions you can get from surgery. So people who have had multiple unrelated surgeries, let's say abdominal surgeries, they've had so many revisions of those surgeries, they end up developing those adhesions, which will affect the integrity of the fallopian tubes and the structure there. And of course, cancer treatment is an issue. And then now I want to go specifically for each gender of the risk factors. So that was just the way of saying what's the primary cause of infertility in different situations, both male and female. But the risk factors, these are things that we can control sometimes. Sometimes we cannot. So, for example, age alone is a risk factor. So people who attempt to fall pregnant later, and this is very important for ladies. So it's noted after age 37, for most people, it becomes difficult to, the chances of getting pregnant become less and less, and more so into the 40s. And of course, there's also increased risk of congenital abnormalities or birth defects. And smoking for both genders is an issue. So I always advise people who are trying to fall pregnant that this is one thing that they can do to help themselves. And excessive alcohol use is also an issue. It's known to affect fertility. And of course, extremes of body weight. So we find that people who are very thin or people who are very heavy, and of course, I will not put BMIs and sizes on that. I think every person has an idea where they are with their weight, but we've seen people with anorexia nervosa, eating disorders. They're very thin, and of course, the whole way that the body is functioning is completely changed. And
Please,
and of
Dr. Mzi, before you go, I would like Dr. Sam to comment on these causes and how he has seen in his practice how people present. Like, I mean, I know that Z is talking about women and men equally affected. What do you see at work?
Yeah. Around my area, what we often see is a lot of people also, apart from what he has mentioned, tend to engage in a lot of concoctions, enema, a lot of
mm,
enemas. It's an African culture. So those things also tend to alter the functioning of the body and the make of the body. So this is
mm,
another thing that is worth noting. Also, you realize that some people also, apart from the traditional herbs that we like taking, some people also love to take medications that are not prescribed. sometimes when they come and they tell you this and this and what I have taken, you just can't understand how on earth they came about all those ideas to put those kind of medications together to put into their system. It is
Yeah.
just surprising, but they tend to do it. And then you come to, particularly where I find myself, is a place that um, we call it informal mining is taking place. And they feel and believe that they need a lot of energy because the more you do, the more you earn. So they tend to take a lot of energy drinks, a lot of things that you can just don't know where they come from, but they just keep taking them. So, and they also expose themselves to a lot of chemicals and radiations, around these areas. So these are some of the challenges that I can also add to what Dr. Mzi has mentioned. Yeah,
Right.
thank you.
And around that, mental health wise, how do they show up to your clinics?
Serious challenge, very, 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 very serious challenge. In fact, I was very happy when you were calling on, how do we call it, in-laws and friends to come
Mhm.
around and listen, because I'm going to take my time and delve deeper into that. I'm going to take my time and delve deeper into that. You realize that there is, when people go through this thing, because as doctor mentioned, they might have spent a lot of years trying, they might have spent a lot of money trying to come out of it, but when it is not possible, they feel some sort of incompleteness.
Oh
Men
yeah.
feel it, women also feel it, feelings
Mhm.
of incompleteness. They feel like I'm not a woman enough, I'm not a
Mm.
man enough. And then that is something that is going on in their minds, in their subconscious mind, some feelings of inadequacy, and then some of them also feel worthless because they feel there is no point struggling all through life, making whatever he or she is making, and there is nobody to succeed or inherit. There is nobody to share his or her successes with. Whom am I going to leave all these things for? Why am I struggling? If it was to be what I'll eat, I would have been okay. But why would I go through all this stress and I don't have even one? There was something that kept coming, whenever I deal with these people. There is a feeling of this sense of, even animals, fowls, chicken, they just go about, play their play, and they are able to have offspring. How much more a human being like me?
Yeah. Wow.
I have tried and tried and tried, and I can't even boast of one. So it is a very big thing that when we are talking of infertility, it's a very serious issue. There is loss of hope, hopelessness. They
Yes,
become very hopeless. And then
Mhm.
it also breaks down their self-esteem. So they get low self-esteem.
yes,
Yes. And then
yes.
Dr. mentioned something about stigma. Stigma, stigma. Stigma is a very big thing here. You see, Africa, we tend to spiritualize everything. We
Mhm.
tend to spiritualize everything. We would want to say, okay, this thing is as a result of your grandmother, the witchcraft and the sorcery your grandmother practiced. That is what is eating up your kids. You know, um, they tend to label couples who have not been able to, conceive, that, oh, your wife is this, your wife's father is that, your wife's mother is that, and they are responsible for chewing your fetus. That's why you don't can't have kids. So all these things, and some also tend to say that, okay, some people have casted spells on you. You've been cursed. You are cursed, and that is why all these things are happening. So go and see a spiritualist, go and see a pastor, and all that. Well, we are all humans. We all have our own sense of divinity and spirituality. But
Mhm.
then these are things that bring about a stigma, major things that bring about a stigma. So we tend to label them and give them very, very bitter, names and labels that really break them. Because looking at what doctor has said, you can see that they might have gone through a lot already. So when you
Men,
tend to also add these to them, it means that you are now shattering them completely because they
yes,
have just a little to live for. They have just a little to be happy about. And so
yes,
when also from outside, instead of giving them some sort of encouragement or something, and you rather bring all these things to them, you tend to, break them. And then we can talk of trauma. A lot of them
mm,
feel traumatized because I can tell
mhm,
you, couples cannot live in a house for 1 year and be consciously engaging in sexual activity because they want to have a kid. They can't have any form of restful time because they don't know when conception can happen. You see, there will be times that they might not be in the mood for engaging in sexual activity, but then probably their GP or their physician is telling them this is a good time, or their gynae is telling them this is a good time to have sex. So, regardless of whatever mood and emotions the person is in, he or she has to override that and engage in it. It is very, very traumatic.
mhm,
Very, 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 very
Wow.
traumatic. You can also experience some discomfort with regular sexual intercourse. There is
Of
some
course.
discomfort that
Of course.
so much regular intercourse can give you. And so it's traumatic when you look at um, women who conceive and they miscarry. It is not an easy experience with them. When I engage with them, you can realize that they are so much traumatized, so much
Yeah.
traumatized. A moment they are happy, there is conception. Another moment, everything is gone. Nobody can account for whatever has caused that. So it's very, very traumatic. And then it's very stressful. It's very stressful when you have to engage in these activities here and there, and you can't just have your head together. um,
Yeah.
i have I have one patient I was dealing with who had also suffered this infertility for a period of time, I think about 5 years in marriage. She never was able to conceive, and more salt was added to injury where the family members, they were living in a family house with the husband, and the in-laws kept throwing tantrums at her every time. They
Mm.
were spiting her morning, afternoon, evening. And it was so bad that this lady broke down with mental illness.
mm,
She broke down with depression.
You know
And
what, Sam?
God being so good, after experiencing the bout of depression where she had been on medication for a period of time, she
Yeah.
started to see light. She got pregnant again. Now,
Thank
after
you.
getting pregnant, the husband now says that now you are pregnant. I don't know what the medication might do to the pregnancy. So I am stopping you from the medication without seeking medical advice. Now, this woman is pregnant, and the bout of psychotic depression is back again. And so they are so hopeless, they don't know what to do. You see, so these are very, very traumatic and stressful situations people experiencing infertility can go through. And so I am very happy that we are going to share these things around with people. You see, there is an anxiety, a serious form of anxiety with infertility, serious form of anxiety.
mhm,
You see,
Wow.
you keep on going, having thoughts of worry about, why am I having this situation? Am I the
Yeah.
only woman on earth who wouldn't, give birth? Am I the only? So there is so much worry, and anxiety
So
is
much.
not just the worry; it's the persistence of it, the recurrence and the intensity of the worry.
mhm,
You see, and then you also tend to worry and have anxiety about what gossips will also be saying.
Of course.
People, Africa, we tend to, poke our nose into everybody's affairs. Everybody's issue is our business. So we tend to, have anxiety about what will people say? What are
What
people
other people
saying?
would say.
Even when we have to leave our rooms, our homes to go into public places, into social gatherings, are there people who are labeling me? Oh, this person is like this. Oh, this woman, they are this, they are that. They chew their fetus, their babies, and so they are not able to. So the stigma
mhm,
also gives them the anxiety that they go about every day. You see, and then
Okay. You know what,
they
Sam?
also most people that I've dealt with also
I would
have
like
to
to
go about
interrupt
with
you, Sam.
the kind of responses, because they can't predict the kind of questions people are even going to ask them about, why
Yes.
haven't you conceived after 5 years of marriage? They don't
Yes.
even know who is the next person to ask me this question.
That's me.
I'm tired giving this kind of responses. What next am I going to tell them? So there is
Yeah.
another form of anxiety that people with infertility, in fact, they go
So
about their daily lives without knowing what life has for them. You see, so
wow.
hopelessness
Sam,
and
you
is
said
another
so
issue. And
much.
then we also see another issue of the autonomic symptoms of anxiety.
Mm.
The autonomic symptoms of anxiety is another thing to deal with, because the anxiety in itself is one, and it's also giving its own form of symptoms or signs. And the autonomic symptoms, they are a way that your body will respond, or your body will give you signals that there is something going on in your subconscious mind, or you are thinking too much. And some of them, they get nightmares. They are not able to sleep, and when they sleep, they get bad dreams, weird dreams, because they are obsessed with a lot of thoughts of this kind of you know issue that they are going through. So a lot of them get bad dreams, and then some also become irritable.
Of
So
course.
when irritability sets in, you can realize that their spouses are also going to feel a lot of pain, because something
Wow.
that um could have tolerated or entertained to be a
Yeah.
passing comment, because the person is irritable, the person will pick up on that, and there will be a lot of argument, a lot of fights at home.
Mm.
Children and people around are going to suffer. Even colleagues at the workplace are going to suffer because of the irritability that they are
Of
going
course.
through,
Of
and
course.
makes them very, very hostile. And so, because of the hostility and the irritability, they tend to lose a lot of friends. People
Mm.
who loved to be in their company now cannot be in their company, because they can't cope, they can't deal with the hostile nature that they have become. They can't deal with how they burst into anger and flirt and blurt out like that, you see. And then the irritability also causes people to lose the anxiety, actually, I should say, causes people to lose interest in activities, you see. So things that hitherto they were comfortable with, they now don't find them interesting anymore. They are not
Yeah.
depressed, but they are so anxious that they can't even put themselves together to make life meaningful or worthwhile for themselves. Some also
Wow.
have
Sam,
shortness of breath,
before we go
chest
on.
pains, and choking. Then there is a possibility of high blood pressure, because you tend to be, thinking a lot. You don't have enough sleep. You don't have enough
Mhm.
rest. Your heart is aching. You are choking. So you can develop very high blood pressure, easily. And when you are developing high blood pressure and this anxiety is still recurrent because the problem has not been solved, that means that you can easily develop heart attack. And then the last thing I would like to talk about is the monster in itself. The monster itself, depression, the illness depression. The least said about depression, the better. Depression is a terrible thing that people experience or go through. Most people who get infertility tend to experience depression because of the hopelessness, because of the anxiety, because of the loss of friends, the company, because of things in-laws are telling them, because of things their spouses are telling them, because of family demands, and even some of them, people who else while needed to have been with them to support them, they give up on them, and they tend to give them a lot of stories that break them, that make them feel worthless and all that. So in fact, the psychological part, the mental health effect is very enormous, it's very profound. Yeah, thank you very
Wow.
much.
Thank you so much, Sam. You've said so much, and I mean, it's basically what Dr. Mzi would agree with the psychosocial aspect of it. Truly, it's quite impactful in Africa. And actually, before we
Hello, I can't hear you.
Yes, I'm saying thank you so much. You said so much, and the psychosocial aspect of it, I really enjoyed the fact that Sam brought that part, Mzi, and I would like Mzi to take us through that medical aspect of how do these people present when they come to you? What do we see? And also those causes you were trying to take us through. Can you take us through that, Mzi?
Yeah, so some of the causes, and I just remembered there, as I say, lifestyle. Before we go to how they present, so lifestyle issues. Of course, we've spoken about smoking, alcohol, um, and some issues. We find out if people are taking excessive caffeine as well, that can be an issue. So we also have to cut down on that. And exercise is important, not extreme, not zero,
Yes.
a happy medium. And and of course, we know in men we have to avoid extremes of temperature like hot tubs, saunas. baths or tight pants,
Yes.
because with the new fashion trends now, that's
Yes.
an issue that we discuss as well.
Yes.
Um, so yeah, so that's one of the things, and I think Sam put it very well that sometimes it comes across as mental health, and when you dig down, you find that it stems from infertility, which they are trying to address, or infertility that they've they've kind of given up without even trying. And as a physician, you have to take them through that. That there's hope. We can do one, two, three. We can help you. And until we tick off everything, and if if we are not successful, then we can say, okay, now we've done everything. But you find that with most people, there will be success, as we say, because people were just not aware of what the issue is. And what do we do to diagnose infertility? So if a couple comes in and say, we've been trying to fall pregnant, and we are not we're having any luck, the most common thing for the young people is the frequency of sex. Everyday sex will not help with infertility. It
Thanks
has
for
to be
mentioning
every
that.
2 days. Every 2 days, so that helps the men to build a reservoir of sperms. Because
That's
if you have sex every day, then you don't have enough. Because volume of this is important for sperm count, and that's why we do semen analysis for men. That's where we start. So frequency every 2 days for a year, as I said, for young people. And I always say, if for whatever reason, let's say they one of the couples is working away and they can't be together at that time, the most important time, I would say 5 days before ovulation, all the way to 5 days after, because the window to get pregnant, that egg doesn't wait for too long.
yeah.
So the chances are very slim in any given moment for anyone to get pregnant,
Yes.
right? Because after in 30 days, your fertile period is very small. So in women, we always advise ovulation monitoring. So now there's devices around day 12. You test your urine and see if you are ovulating. Some women would say they know when they're ovulating, which
Yes,
I
of
think
course.
is
Yes.
quite an impressive thing,
Yes, you
because
feel the
it's very
fever,
scientific.
you feel irritable, you
Uh-huh.
feel a pelvic pain. I was ovulating just a few days
Mhm.
ago. I felt that. So I know
So I
exactly what.
find that quite impressive.
Yes, yes.
So if someone can identify when they are ovulating, that's another plus. So for men, we would do semen analysis, hormone testing, um, and then those are the simple ones, and then the invasive procedures that we go to, genetic testing for some people, which is very extreme, testicular biopsy, and of course we do some imaging. Look at the testes. Is there something abnormal there? Look at the tubes. Are the tubes working? Look at the urethra. Remember, we said sometimes we have issues with the urethra or the transportation of the sperms. So we do the imaging to look at all that. And in ladies, as I said, ovulation testing, which you can do at home, or if you know yourself,
Physiologically, we can
then
tell.
then we can we can skip that. And of course, HSG, hysterosalpingography. So HSG, again, to check if those tubes are open, and of course they use contrast, and they can see if there's any blockage there. And most people, they find that the HSG is normal and they get pregnant. And one of the specialists that I worked with was saying, even that pressure of putting that contrast in the uterus opens the fallopian tubes, and things get easy. So, and people don't go even further; they recover from the HSG, and boom, they are pregnant. And
Wow.
of course, um, uh, imaging again. Look at the ovaries, look at the uterus, and make sure everything is good. The hormone testing as well, do the hormone panel for the female, and then of course, in rare cases, we look at laparoscopy, where you go and look with a camera and find out if there's endometriosis, because endometriosis, you have to see it with the camera to say, okay, there it is. And hysteroscopy again, which is the imaging of the uterus, to go and look with a camera there. And so to be able to treat infertility, we have to know what's the cause of infertility. How long have you been infertile? So there is primary infertility and there is secondary infertility. So some people have one child and they struggle to get another child afterwards, and they can't explain it. Then that's when we have to get more testing. And sometimes they change partners and then they can't get children with the other partner. So it can happen that maybe the male had another a different partner, and then they have the child. Then with this female, they're not able to fall pregnant, and then the same thing for a woman. And with another man, they can get pregnant and not with the other one. So we have to be aware of what exactly is the issue. Is it primary? I've never been pregnant, or is it secondary?
I'd like you to emphasize on that, Dr. Mzi, because a lot of times that's when there's that stigma. You know, a man who has a child from his prior relationship or marriage, and then automatically thinking that it's your problem, it's your fault, you are incapable. And it could be sperm count, or it could be the fact that, like you said, the age matters. What if maybe this man is in his mid-40s and maybe his child was when he was in his teenage years, or he was in late adulthood, he was 20. Now this is 22 or 25 years later, you are unable to have a child with your woman. So I would like men here watching us to pay attention to the fact that sometimes it could be primarily
the man. Yes.
Yes,
because the society just unfortunately just assumes it's the problem with the woman, and it's not.
It's the patriarchy. It's the patriarchal laws that we have.
And then it creates that toxic attitude towards women, and so that's a very key thing. As you said, things change. People get exposed to other things in the environment, and then their fertility gets affected. So and of course, we have to also find out what the preferences are. I've had issues. So for some people, when we get to the techniques, some people don't want certain techniques. For example, IVF. I have a family. They are pro-life, and was saying I cannot live with the idea of having 5 embryos in this dish and then having to choose one and let go of the other. So, so the preference becomes a big issue even before you pursue it, because it helps just channel you. Then you put your energies in the right, on the right path, because some people don't want certain things. So you let the patient be the one who directs it, because they are the expert of their condition, and you are the expert of the science, and you are there to support them.
I love that. That's amazing. I love that, because sometimes
that's great.
that was beautiful. See, out of sorry, I lost you guys there. Out of maybe excitement on the doctor's end, want to also prove the science that and also knowing the percentages and the successes of these experiments. So we need to be sensitive and be respectful of the couple's choices. I love that. Thanks. Yes.
So the treatment, in summary, for men, changing lifestyle factors, in terms of, as we talked about, drugs, frequency of intercourse, exercising, and all the lifestyle issues, medications, remove the medications that affect fertility, and anything that really compromises the testicular functioning. And in some cases, there may be surgical interventions. As I said, strictures can be can be fixed surgically,
Of course.
and so on. And sometimes if there is a complete blockage, we would use sperm retrieval to go and just get the sperm and
Yes.
help if there is no way of opening that pathway. And
Right.
in women, the most common thing we do is ovulation stimulation with the fertility drugs, Clomid, and intrauterine insemination. So if the cervix, for whatever reason, is tight, all we do is get past that by doing the artificial insemination, and
Yes.
of course, surgical interventions for structural issues as well. Uterine structural thing. If there's fibroids, if there is, just the way there's. Some people have a uterus that's got two cavities, and
Yes.
sometimes it gets corrected. Some get pregnant, and it becomes a high risk issue. And of course, we do have techniques that so IVF is done, but other also quite specialized, which you will get from a fertility treatment center, where you would have intracytoplasmic sperm injection. I won't go into details as well. And some people, if the issue is with carrying the child, they would go with surrogacy.
I love
And
that. I
and,
want to mention that
and
in
part of
Africa,
the
because it's not something popular yet, and also it carries a lot of stigma that
Mhm.
you do not believe it was your child. I love that, Mzi.
Yeah, so surrogacy can be used in many cases, as we know. If the woman has an issue, or now we're seeing it more and more in same-sex partners, and unfortunately, this is something which you find that in some societies they don't want to talk about, and it's a reality. It's something that is out there,
Yes,
so it's also part of that.
yes,
Um,
yes.
so not so much.
Wow.
Mhm,
Mentioning that, actually, we even see it in celebrities that
mhm,
say, I don't want any changes in my structure. I don't want any changes in my abdomen because of the pressure of the industry they work in. People now are starting to utilize surrogacy and people are making money out of it. So things have evolved. And I'm not sure if it's also in Africa, but we're starting to see a lot of people doing it in America, not wanting any changes that come with pregnancy. It's quite interesting phenomenon.
sorry.
We are
Even
parents here. Don't you worry. Don't you worry if she wants to join us. And Z, I would like you to tap a lot on the sexually transmitted infections because
Mhm.
in Africa specifically, when we looked at the global stats of infertility, we see that Africa is mostly affected by sexually transmitted infections.
Mhm, mhm.
So I would like you to talk about that because when I looked at the strictures on the penis, on the urethra, and also the fallopian tube blockages, chlamydia plays a big role.
Yes, and it goes to what Sam was saying. We tend to spiritualize everything,
Yeah.
and unfortunately, STIs is one of those. And you'll find that again, they will say you only have an STI if the woman has a certain issue or is a witch, or all those things, and then they end up not seeking help, and there is no spiritual side in STIs. I always tell people it's an organic thing, it has to be treated.
Yeah.
So people should know it's an infection that is treatable. So again, the stigma keeps away people from seeking help, and the beliefs that people have, spiritualizing even the STIs becomes an issue.
And there's
So
also polygamy that comes into play in our African
yes,
continent.
certainly polygamy, and again, if you find people who have multiple partners and they're not able to disclose that to their partners and say, you know what, I have multiple partners, is this working for you? Because now some people, if they choose that, they do that, but they have to be open about it. And unfortunately, in polygamy, you find that the power sometimes women are not able to stand up for themselves in some cases. I'm not saying in all cases, but in some cases. And
And in most
and
cases.
then you get this man who's got these wives and just
Yes,
spreading the infection.
yes,
And again, it's difficult for a woman to say, you know what, I have an STI, because again, it will be like, no, you slept with someone outside,
yes,
and
yes, yes.
it's never
And the mentality in
the
Africa that
mentality.
I am the one who is sleeping with all of you, the men tend to have that mentality that then
Hmm.
if you had that infection, because let's remember, women, they tend to present more to us with
Hmm.
the discharges because of their urethra being short. It's
Hmm.
for them to present to the clinics to us. And that's when the beatings and also the being ostracized occur,
Hmm.
because your husband
Yeah.
will say, definitely it's you who brought the
Hmm.
infection to the house. That's what
Yeah.
he said.
Yeah, so it's one of those things, and again, and you know, it gives us another thing to do as advocates in healthcare, that we should teach people and we should encourage people to come forward and destigmatize all these issues, because you know, by removing that stigma and helping people to be able to get help as much as possible when they have infections and all that, you prevent the complications, which are in this case infertility, which again, you know, will lead to things like depression, isolation, or alienation in the community and all that. So
And
by doing that
suicide.
simple step, is helpful. So yeah.
Thank you so much, Mzi. Sam, we're gonna close here, and I just realized we actually did not connect to Facebook, and that's where mostly the comments are coming from. So that was an error on my end. I realized that it was not connected. So I'm gonna ask Sam. Sam, what is the percentage of suicides you see in your area? Because I know that the studies show that women now, even men, they start committing suicide because of these issues, and mostly due to stigma. That's why I said in the beginning, we need family members here. We need the in-laws because they cause all this. What's your take there?
Yeah, I would say that as you indicated, yes, some people tend to commit suicide because of the depression, because of the worthlessness, because of all those things that they go through. So yes, it is true. Yeah, people tend to commit suicide um, because there is no support. There is no support. Yeah, there's no support. I okay. So let me touch a bit on what Dr. MZ was saying. You see, in Africa, in our part of Africa, we realize that there is so much indiscriminate sex going around, not even among married people, but among the youth. And this is where most of them, even as young as 16, 15, 14, they begin engaging in indiscriminate sex at funerals, at social, organizations, social gatherings, and all. Some engage in a lot of substances, drinks, and tramadol, and all that. And at the end of the day, other people take advantage of them, and these indiscriminate sex goes on. And so you realize that most of them will even contract these things without knowing they've contracted them. And some of them would not even go to the hospital for thorough medication, for thorough treatment. They'll just use sideways, concoctions. And when they don't see the thing again, they feel it is off. And so
Yeah.
they will live with all these infections for longer years.
Hmm.
It will
Hmm.
do them a lot of harm before they realize that, okay, let me go to the hospital and check. Before they realize this thing, they can't even trace when they had that, they contracted that
Yes.
infection. But that has been decades away, and it would have done a lot of havoc. So this is imperative on we healthcare personnel and advocates to really educate them. And there is another perception I see around Africa, especially in Ghana. Most people don't want to even use the condom. They don't
Hmm.
want to use it. But it is one escape, because if you know you cannot engage in indiscriminate sex, then your only lawyer is
Condomize.
the condom.
Hmm.
Your only lawyer is condom. But then most of these people don't want to use condom. And it comes again to stigma. A lot of people frown on the youth who will go and want to buy this thing. What are you going to use it for? What? And now that the pressure on them, and so they will want to shy away and go and do it, without a condom. And then we forget that the risks of having affair without the condom, because no matter what you do, they will engage in it. So why don't we support them with what will protect them, will protect their lives,
Mm-hmm.
will protect even premature, conceptions, and all these teenage pregnancies and all. So we can cut down on all these things. So society will be free, and we would also have some peace of mind. And
Mm-hmm.
then the resultant effect of infertility. So this is another thing that I wanted to add to what doctor was sharing. Sorry. Another thing that I will touch on before I come to social support, I want to deal a little on social support before we go off. Is because of the psychological issues that they go through. There is this way of life. It's called RAP, Wellness Recovery Action Plan. It's one thing that when we tend to equip people who are going through these problems with, they would get their self worth back, they will get their wellness and their well being back again. And then they will have some sort of resilience against the pressures that come around them.
Mm-hmm.
And so I will recommend strongly that when people are going through such situations, we will look for people who are facilitators in RAP to take them through Wellness Recovery Action Plan. It will really do them a lot of good. In Ghana, it is widespread, and we have a lot of people going through RAP. And those in the US, I'm sure they can also access RAP. So RAP is another thing that can help. And then in the absence of RAP, we can also look for mental health personnel who will take them through counseling and psychotherapy to support them with the issues that they are going through. And then adoption is also one of the things that we can do, as we were talking about surrogates, a thing. Adoption is one, but then it comes back to our attitude as Africans, the stigma and the way we spite people.
Mm-hmm.
Are we also confident enough to even adopt so that the child will be with the adopted parents for life without even hearing that he or she was adopted? And see, go look for your roots. These are not your parents. You don't know your identity. You see, so all these things tend to break a lot of people, and though it's one way out, it's another thing that people tend to contemplate on. Would I suffer some of these, challenges along the way or not? But all these
Mm-hmm.
things are real issues that we need to consider, whilst dealing with that. And so, and I would like to deal on social support. We are calling on spouses. We are calling on family. We are calling on friends. We are calling on societies, police at the workplace, especially spiritual leaders. Spiritual leaders. We need you all to give support to all these people. The past is past, it is behind. Stop, painting the past in people's, rubbing it in their faces, and making them feel worthless. And we even tend to put them in hell before they die because of some of these issues. Yes. So we would really call on all these people to give support to
Support.
people and couples that are going through these things. This is not the time for you to scorn them. This is not the time for you to show superiority over them. If by the grace of God you were able to be holy in the days past, glory to God. That is past. Let's see how we can support them. And I also want to call on family and friends who always are putting demands and pressure on them. When am I getting my grandchild? When am I getting my niece? When am I getting my cousin? And all this, please,
Yes.
you tend to kill them. You tend to kill them. You're adding so much load to what they are already carrying. It is a very
Mm-hmm.
bad thing, and we need to talk about it so that people tend to realize the effect of what they say. It is very grave. It is very grave. It kills people's spirit. Yeah. And then I would also want to encourage people to just, when you see somebody is going through issues, please, it is not for your public consumption. That is not your subject of
Mm-hmm.
conversation.
Yes.
That is not your subject for conversation. Just just respect people and respect yourself. Let people have their privacy. Let
Mm-hmm.
people, we gossip so much. We gossip so much. We tend to, everything we do tend to kill people one way or the other. And we need to change the narrative. We need to be conscious of some of these things and then change our attitude and our lifestyles towards some of
You
these
know,
things.
Sam,
And
that
yeah,
actually that reminds me of one of the key things I usually use in the practice is, you know, when I talk to people who are supporting people dealing with infertility, or sometimes we call the family in as well, is stop asking couples, when are you having children?
Yes.
Because you don't know what they are going through.
Yep.
So the pressure that people put on couples, everywhere you go is, when are you having children? And you can't explain that in you don't owe anyone an explanation when you are having children, and you only to find that these people have had multiple pregnancy losses, or they've been trying. It's been so emotional for them. So that is very key for us to respect people and not put pressure on them, because we do not know half the story of what they are going through. And I've
you
had
see what?
couples stopping
Okay.
from going to church, going to public gatherings with people of their age because they feel so alienated. And
Yeah.
everyone has children. If they don't have children, and
Yeah.
people always ask about them, that, oh, you should have children as well, while they've been trying for the past 5 years, you know.
You
So
know
that
what?
is very
I
good.
would love to
Yeah.
continue this conversation with
You
you,
see,
gentlemen.
Dr. Inati, please give me a second. Let me, you
Oh,
see,
sure.
the
Go
truth
ahead.
of the matter is in Africa, you see, nobody is so sufficient and competent enough to even marry prior to 30 years. Most of us, because the economic situation is bad, it's so precarious. So before the person is marrying, sometimes it's not even the beauty and the fun of the marriage itself. It is the quest for kids. That is what even push a lot of people into marriage.
Mm,
So you sitting outside there observing them, you are not more passionate and eager for them to conceive and have kids more than they themselves.
mhm.
You are
Wow.
not more eager than they themselves. There is an issue, there is a problem, there is a challenge that they cannot surmount. That is why it has not come yet. So that is not the time for us to be asking them questions that they themselves are very much aware and conscious of. They are
Eh,
more passionate about it than you yourself. So we don't need to go about giving them. So this is why I call on them to accept them, give them the support, accept them as they are, whatever they are going through. Give, you see, nobody is worthless because he doesn't have a baby, he doesn't have a child. No, it's not so. No one is worthless. You see, so we need to give them the support that they need. And then again, I would also want to re-emphasize that it is, in as much as it is a bitter truth, it is so with almost every living organism. It is not every living organism that bears fruit. It is
yes.
not every living organism that bears fruit. We should bear
Hmm.
that in mind. So if accidentally you happen to be one, unfortunately, please don't beat yourself up. Don't kill your partner. Don't kill your daughter-in-law. Don't kill your friend. No, is not every tree that bears fruits. Even go to people who are doing pottery. It is not all their layers that lay egg. Not at all.
I love it,
Yes,
Sam.
so we should bear that
That
in
was
mind.
wonderful.
Yes, so we should bear that in mind. And then I also want to emphasize on men who love to use a lot of lubricants during sex. Lubricants in
That is
sex.
key.
I beg.
That is
It
key.
is a very, 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 very bad thing. We don't know the effects that we are causing to ourselves. So we should be mindful of
So,
some of
so,
these practices. In as much as,
so,
yeah,
Sam, the lubricants. I wanna weigh in on that. It's one of the issue, but now they've developed some lubricants that actually are pro fertilization. So
yeah,
you have to be specific. If
exactly.
so,
Okay.
avoid it if you can't. But
Yeah,
if you really need lubrication, get one that is pro fertility, and
yeah,
your doctor, your fertility center will guide you in that way.
I love
Um,
that, Mzi.
so yeah,
Yes.
that is key. Thank you for mentioning that, sir.
Thank
yeah.
you.
And for spiritual leaders and in-laws who are placing a lot of demands on all these people, we beg you, the best you can do for them is to support them in prayer if you believe in one.
Yes.
Prayer,
Thank you so much, Sam.
prayer, social support, social support. Thank
Thank
you.
you so much. Yes. Dr. Mzi, any word of closure here for our people to take home?
So I wanna again just emphasize that infertility is a health issue as much as it's a personal issue. It can be mental health issue for some people, depending where you are in that journey. So it's a health issue in summary that is treatable. That is treatable. If you want to have children, do not give up without exploring issues and seeking support.
Yes.
Seeking support from the medical and seeking support from people that you trust. It's very important to have people that will support you and respect you. So it is treatable, it's an issue, but you have to have the courage to bring it forward and have someone to walk the journey with you.
Thank you so much, guys. And in closure, I'm so grateful for our viewers here, and we're gonna transfer our presentation here to Facebook too. I see. Thank you so much for YouTube viewers too. And in closure, like my guests mentioned, we need to practice compassion, kindness, love, and more than anything, our emotional intelligence needs to come into place. More than anything, families, please stop putting pressure on couples. You don't know what they're going through. And also be sensitive with your words, be kind with your words, also stay on your lane. That's all I can say. Sometimes, actually, we just didn't have much time. Some couples nowadays don't want to have kids. Stop asking those type of questions.
Exactly.
It does not necessarily mean that they are infertile. This is another discussion for another day. We're starting to see now women and men, people are career driven. They don't necessarily want to bring children to this ugly world. That's how they do it. Or they just choosing not to. People have so many reasons. We cannot underestimate and think that they are less of a human when they choose not to have these children. People have their own reasons. We need to be respectful of them. Again, thank you so much. Stay with us here next week. We're going to come back with another heartwarming topic. I'm so grateful that we brought this to discussion because these are the issues that matter to us as African people or as people in general. Without forgetting to thank my guests. Thank you so much, Dr. Mzi, and thank you so much, Sam, for coming through. I'm hoping to bring you guys again on the future shows.
Thank you.
Thank you.